All right, Thursdays we always talk health, your health specifically, and we're going to do that today. Dr. James McKinney III is here from New Hanover Regional Medical Center. Today's topic, stroke. The first thing I said to you is I appreciate that you came in casual because it makes me feel so much better to just go in ease about things like this because stroke, it's a very serious topic. It's something that I didn't understand how serious time was until we started doing these segments here. Time is really of the essence when you're talking about stroke.
Yeah, that's right. So it's May is Stroke Awareness Month, and so I'm glad to be here. When we talk to the community and go out and teach people about stroke, the main things we want to tell them are the warning signs of stroke. And there's an acronym called FAST that we want people to remember. And the F stands for face. And is there a facial droop? The A is for arms. Is there any arm weakness? So you have the person hold up their arms, and do they drift, or is one side weak? The S is for speech. Is there any trouble speaking or slurred speech? And the T is for time, and that's what you were getting at. It's time to call 911. If you have that, you're more likely to get treated and treated faster if you use emergency medical services to get to the hospital. And it's important because all of our treatments are time dependent. Mm-hmm. We have a strong blood thinner or a clot busting medication that we can give through an IV within 4.5 hours of symptoms starting. But the quicker you're treated, the more likely you are to have a good outcome. And then we have some interventional therapies also that are relatively new and that have been developed in the last few years that we offer at New Hanover, where an interventionalist goes in with a catheter similar to a heart catheterization that people have for heart attacks, but they snake that catheter all the way up into the brain to the side of the blockage and pull out the blood clot. It's been shown to be beneficial up to maybe 24 hours from symptom onset, but again, the earlier you get into the hospital and the earlier you're treated, the less likely you're to have a major stroke and the more brain we can save.
And it seems the hospital has taken this one step further, that there's a team now that specializes in this, that if I call 911 and say, you know, hey, I think my wife is having a stroke, there's a specialized team now that responds in order to get you there with the proper treatment while they're en route to the hospital.
Correct. From the initial call, the EMS will send an ambulance crew that's able to identify stroke. They'll let us know when they're inbound if they suspect that a person has a stroke patient. So we'll get a page on our phone that has the age of the person, the last time that they were normal or when their stroke symptoms started, and a rating scale on how severe their symptoms are. So we know before the person's even at the hospital really how sick they are and can kind of get an idea of what treatments they may need. Then the stroke team, which includes myself or one of the other stroke neurologists, an emergency medicine physician, stroke nurse, ER nurse, and the ER pharmacist all meet the person as they come into the ambulance bay with EMS. They give us a brief kind of report of what happened. We examine the patient quickly and then go straight to CT. The real test that we need to do immediately is a CAT scan. There's two types of stroke. There's one from a blocked blood vessel from a clot. And that's the one that we can treat with the catheters and the blood thinners. And then there's a second type, which is a hemorrhage or bleed into the brain. That type's treated a little bit differently, but that CAT scan differentiates those two.
And I joke that it's almost as if you have a NASCAR pit crew on you, that it is just everyone has their own job to do this and to get you taken care of. You know, we've said the time is of the essence. This is one of those you do call 911 right away. I joke all the time, don't call me, you'd be surprised at emails that I do get. So, hey, I think that I have this problem. Call 911, get yourself to the facility as quick as you can. Doctor, I appreciate the time.
Great, thank you.
We're going to come back.